Let you listen to Dr. Alex Garza. He's the St. Louis Pandemic Task Force commander, but he's talking about this from a situation of treatment and possible vaccines and what happened at the lake, which goes across the entire state. People were at the lake. There were lots of people social distancing, but there were also a group of people at 5 or 6 bars, at least, that have given us images that are now making international news. Your thoughts on the lack of social distancing at those bars and pools?
Yeah, that was very unfortunate to see that people weren't following the prescribed, recommendations for social distancing, wearing masks, things like that. And you get it that people, it's the first weekend of summer and people want to be outdoors and socializing and things like that. But we're not in normal times right now either. And so we have to take this seriously. The vast majority of the population took the right precautions. And I think we do need to celebrate that while also issuing those words of precaution about, look, this is not normal times. This isn't a virus that's gone away. Everybody needs to participate in all of these efforts if we want to be able to get through this as safely and with as little disruption as we can.
So if people were exposed and become infected, how long would it take to see the caseloads rising in parts of Missouri?
It takes a little bit of time, and by that I mean you have to have exposure, and then there's an incubation period that has to occur, and that's when people then start shedding virus. And so anywhere from around 3 to 5 days is where we typically say that incubation period. Now you have to remember it depends on whether the person becomes symptomatic or not as well. And so there's a probability that people will get exposed, develop the infection, but never develop symptoms, but they're still spreading the disease just as much as somebody that does develop symptoms. So if we were to see a spike in activity from what occurred on the week, we would probably see it within a week to 10 days. I do think it depends on where you are, and so in places like St. Louis County, our metropolitan area, where we've been dealing with a lot of cases and we've seen some hard-hit areas, I think our mentality is maybe a little bit more different than other people's, where you're not seeing as many cases or you haven't seen that many hospitalizations. And so from what I've seen and from what I've experienced, going around town, going to stores, things like that, I do think people are taking it very seriously and are taking all the appropriate precautions while being able to open up stores and things like that.
Where exactly are we when it comes to the treatments? And let's start off with the word that became very popular in the beginning with the president, and he was even using it last week, and now he says he's not using it anymore, that being hydroxychloroquine.
Yeah, hydroxychloroquine has had sort of that roller coaster ride, as you've mentioned, from early on, people touting its benefits, and it was being used for COVID infections early on. The recent trials, though, that have involved hydroxychloroquine have not shown as much of a benefit as people expected. In fact, it's shown some harm. And that's because it is a cardiotoxic drug, and so it's not something that doesn't have a harm profile either. And so most people, I believe, are moving that down on the list of appropriate therapies, and certainly for preventive therapies for COVID. Now there's a couple of other promising approaches, though, and so one is the remdesivir drug, which they just recently published some of their findings, which showed that at the time that they were hospitalized came down from 15 days to 11 days. And so that's good. It does still need to narrow its profile on which patients it should be used on. And so there's still more data that needs to be figured out to see what is the ideal patient for using remdesivir, because it doesn't show as much benefit across the whole spectrum of patients. So there's still a little bit of work to be done to say who should we be using these drugs on. The other one is plasma therapy. So antibodies that have been donated by people that have recovered from COVID, and those are showing some promising results as well. But again, it's getting down to who are the right patients to use this for. So you want to make sure that you're using this on patients that have developed infection but haven't quite ramped up their antibody system yet, so you can get them through to where they can start developing their own antibodies. If you get it too late into the infection, it's not as useful than if you get it early on in the infection. And that's really sort of the hard part, is how soon can you get this drug or the plasma for patients that could really use it the most.
As far as a vaccine, Dr. Garza sees progress, but not anytime soon.
many different candidates for vaccine development, and some are really exciting, showing a lot of benefit, a lot of antibody production to people that have been given the vaccine. Starting phase 2 of their clinical trials, you hear anywhere from, gosh, we think we can have vaccine to the, at the end of the year, all the way up until we're still a year out. So it really depends on how fast we can get through these phase trials while maintaining all of that safety profiles that we have to make sure that we do. Best case scenario is probably end of year.
And Dr. Garza reminds everyone the virus has not left us.
It's not going to end next month. It's not going to end in 2 months. It'll end when vaccine is here or when we have immunity in the population. And so we all have to recognize that this isn't just going to be a short-lived thing. It's going to be more concerning in the fall when flu season comes along. So what does that mean? That means we all have to continue to practice all of those things that we've been doing.
And Dr. Garza and his team said, we can't tell you enough. Please let the entire state know to give blood now. They are very short when it comes to blood donations. So